All right, perfect. So today we're going to be learning more about Excelsior University's newest program, which is our Bachelor of Science in Nursing. This is a hybrid program, and it's going to be based out of our St. Petersburg, Florida site, which is also brand new as well. Uh, we have two terms coming up. Right around the corner is our March 2nd, our spring two term. And then a little bit down the road, we have our summer one term, which is going to be on May 4th, we'll be starting. So if you have some of your requirements completed, like the TEAS exam, which we'll get into a little bit, you may be able to hop into the March 2nd start. If you've done nothing yet, and this is the first time you're checking us out and kind of doing anything, you're going to be targeting our summer one start, which will be May 4th. Pretty straightforward agenda. I do want to inform you a little bit about Excelsior University, just so you have an idea of who we are and what we're about. We'll talk a little bit about accreditation, which is very important. I want to make sure you understand our accreditation. Then we're going to dive into the Bachelor of Science in Nursing. Again, can't emphasize enough, this is a hybrid program. You'll hear that a bunch throughout this presentation. We'll go over the finances, what this will cost you, and how you can finance your education. We'll go into the admissions process, assuming you love this and you want to move forward with applying. We want to make sure you know how to do that. We'll set you up with some next steps, and then we'll end with questions. I do have a couple representatives from our admissions team as well as our nursing leadership team on this call with us as well today. So thank you for those of you that have hopped on and are joining me. All right, so Excelsior University, we were founded in 1971. We are a nonprofit institution. Initially, we really were all about helping working professionals gain degrees as quickly as possible, right? So we wanted to make sure that we were awarding our students for the work that they've already completed elsewhere, whether that be at a college or a university, or maybe that was professional development. Maybe they've been a manager for 15 years. We wanted to help them get experience for that additional work that they already put in. So that's kind of what we started out as. Over the years, we have grown. We've added additional programs, and just a few years ago, we became Excelsior University. We gained the university title. So we're continuing to grow. As you can see, we're currently at 40 plus programs. And as I mentioned in the introduction, we just launched our first site down in St. Petersburg, Florida. So now we have a location there as well. This second bullet point comes from our mission statement. It's something that when I first started with Excelsior really jumped out at me, and that is that Excelsior meets students where they are both academically and geographically. And we're staying true to that, right? We want to help students get credit for the work they've done and making sure that our programs are top notch. But we also have that flexibility of doing them online, and now we are adding in physical locations. So it's still true that the geographical piece as well. Fun fact, average student is 35 years old. The reason I say this is a fun fact, something else that stood out to me when I first joined was our youngest graduate is 9 years old, and our oldest graduate is 84 years old. So it's pretty interesting. All right, Excelsior's accreditation. So whether you decide to attend Excelsior or any other university, please do your research and make sure that institution is accredited. A lot of jobs, a lot of exams like licensure exams, for example, the NCLEX, they're going to require that the school is an accredited institution. So you want to make sure that when you're doing your research, you're making sure that the school you choose is accredited. So Excelsior University is accredited by Middle States Commission on Higher Education. Several of our programs have programmatic accreditation. Those are the different icons and titles at the bottom of this screen. I will highlight, we do have some bachelor's level and master level programs that are ASIN accredited. This program is not yet ASIN accredited. You actually have to have students going through the program in order to meet certain criteria. So rest assured, once we do have students in this program, since it is brand new, we will be applying and making sure that this program also meets the requirements to be ACE and accredited. So just want to be clear and make sure everybody understands that. Currently, we do have some bachelor's and master level programs that are ACE and accredited. This particular program is not. And again, that's because we need to have students in the program to be able to meet criteria to apply, which we will be doing at a future date. Okay. So why would someone consider doing a Bachelor's of Science in Nursing? I will sum up this slide very, very neatly. The United States needs qualified nurses, and we need them yesterday. So not too long ago, I read an article. Florida in particular has a shortage over the next 10 years of 60,000 nurses. One of the main factors that's driving that is 40% of the current workforce is nearing the age of retirement. So a lot of nurses would already be retired if their employers are not asking them to stay on board in some capacity. So there's an aging workforce. There's a need for nurses anywhere in the United States, especially in nursing right now, or especially in Florida right now. This program does lead for you to be able to sit for the NCLEX RN exam. Okay, so if you are able to successfully complete the program, you graduate with your degree, that will allow you to sit for the NCLEX. So just be clear on that. And then this program is going to help you get exposure to a lot of different areas. So you'll take coursework in medical surgical, pediatrics, maternal newborn, mental health, community health, and in leadership. So it'll allow you to kind of get some exposure to really see what area of nursing do you want to focus on and possibly work in. As mentioned multiple times, this is a hybrid program. So how that would work, any of your didactic courses, your lectures, those are going to follow our typical online format. Online courses start on Monday, they run through Sunday. You'll have discussion posts that you need to participate in, and you'll have assignments that are due throughout the week. So you'll have due dates that you do need to turn things in by. So the majority of your didactic and lectures are going to be in that online format. When you get into courses that have nursing lab requirements or simulation requirements or clinical requirements, that is where you're going to get into the in-person components. So our St. Pete's location does have 2 nursing labs as well as 2 simulation bays that our students will be physically coming into the location and completing those requirements. Again, this is a program that requires applicants to be a Florida resident because you will be required to come in person throughout the program. The program is a total of 120 credits. Here is the breakdown. In just a few slides, I will give you an example of what the curriculum and the years may look like as you go through this program. I did want to show you, though, since we're not physically on site, what some of these labs may look at. So these are just short little 30-second clips, but here is our first nursing lab at our St. Pete's location. Again, a lot of this equipment is exactly what you'd be using at a doctor's office or in a hospital. The supplies would be the same supplies that you would use in treating a patient, so you get used to using the actual equipment. This is our second nursing lab. These again are designed that and hope when you walk in there, you're feeling as if you're walking into a hospital setting. And then the last video that I have to share briefly is one of our simulation bays. Again, as if you were walking into a hospital room for a single patient. This is where the simulations are going to be some sort of a setup example of what that patient's going through, and you're going to have to perform as if it was a live patient. So it's really the best way to practice without practicing on a real human being. So again, just wanted to give you an idea of what the facility looks like. Yep. All right. So clinical partners. This is an important piece. We currently have 12 locations and we are actively growing. Two of the partners that I can share are Empath Health and Advent Health. We do have some others in the works, but we're not at a point where we're ready to share that information quite yet. But as we get these different partners and the agreements secured, we will be announcing those things. These are the agreements. We're pretty excited to be able to get these partnerships set up. But the good news is we currently have 12 locations. So by the time you get to the clinical portion, which will be in your second year of the program, you are set. We have clinicals ready for you. Bachelor of Science in Nursing hybrid curriculum. So this is a sample, but for the most part, this is what students can expect. This program is designed to be completed in 3 years, so it is slightly accelerated. Most of the terms you'll be completing 2 courses at a time, some of them 3 courses. Each term is 8 weeks in length, and our students attend continuously year-round. So again, once you get started, the expectation is that you're going to continue term over term in a cohorted model. So the nice thing is the students that you start with, you'll progress through the program with, and hopefully all graduate together. So as you can see on the screen here, this is mainly your general education and your sciences, right? Building that foundation so that you can be successful in the next courses, which will begin your nursing core classes. Couple things I want to highlight. Anywhere that you see ALT or alternative, that symbolizes a course that you could select something else. So those are general education courses, liberal arts courses, and you have some flexibility to pick and choose which courses would be available that you want to take during those times. If you transfer in courses, these may be the courses that you would be applying credits from somewhere else. And then the other thing I want to highlight, if you see this ZTC, that stands for zero textbook cost. So one of the things that we pride ourselves on is helping make our education affordable and keeping our prices affordable for our students. One way we do that is through the zero textbook cost. So several of the courses you can see here in your first year would not have any textbook costs. So we jump into the second year of the program, you'll begin to see nursing courses pop in here. You'll begin to see labs, and you'll also begin to see clinical. And just so you're aware, you would do those things simultaneously. So while you're taking the course, you would also have a lab component, and you may also have a clinical component that same term. So you'll notice the same course with either a C or an L after it. And then your final year. So again, just wanted to give you the best idea I could of kind of the courses that you would take, the structure in which you would take them, and how you would progress through the program. Transfer credits. So again, as I mentioned way back in the beginning of this presentation, we pride ourselves on helping working adults get credit for the work they may have already completed. And sometimes that's in non-traditional ways, right? Not at a university or a college. That's credit for prior learning. So I am including this link here. Again, this recording will be sent out to everybody that's attending so you can reference these later. But credit for prior learning is where you can submit to see if you can be awarded credit for trainings, professional development, work experience that you already have. The second part on this slide is going through our transfer credit policy. I'm going to guess that some of you may have researched other nursing programs. And if you've looked into their transfer credit policy, I'm guessing you'll see ours is pretty generous compared to most nursing programs. Again, we want to stay true to our mission. So a C minus or above, general education courses, there's no real time frame. Anything that has to do with sciences, that's going to be within the last 5 years. So again, most programs that I've researched or worked in the past, they usually look for a B or above. So this is generous, and we want to make sure we're sticking true to our mission. All right, financing your education. So I like to be upfront as I can be when I go over this. The cost per credit hour is $618. That includes your tuition, which is $550 per credit hour. It includes an academic fee of $40 and a technology fee of $28. So that totals the $618 per credit hour. I do just want to be clear, there are some additional fees. So for example, there is a graduation fee. At the time you complete your program, it's a one-time fee. And then when you get to your nursing core courses, those NUR courses that you saw in the second year of the curriculum grid, there is going to begin to have an ATI cost. We do utilize ATI, and there is a cost to do that. We spread the cost out over those NUR courses. It's going to be right around $3,300. We break that out to $578 per course once you hit those nursing core courses. So again, just being as clear as we can be up front, there are some additional courses throughout the program. From a tuition and fees standpoint, to give you an idea, if you had to complete the entire program without any transfer credits or applying anything to the program, you'd be just under $75,000. If you were to transfer in, say, 30 credits, now you're looking closer to $55,000. And if you were able to satisfy half of the degree program elsewhere or through transfer credits or prior learning, you would be looking at roughly $37,000. So at the bottom of the screen, you'll notice partnerships. Partnerships are huge. We have a bunch of them. We encourage all of our applicants and anybody that's interested in our school to check out our partners page. If you're working for an organization right now, there's a chance we may have a partnership with your organization. On the flip side, if we don't, let us know. Maybe we can get something established with them. So again, one way to definitely look to see if you could possibly save money is to see if we have a partnership with your organization. Usually those partnerships include some sort of a discount off tuition. So please check that out. Ways to finance your education. Financial aid is available. You do need to apply for that and qualify. So that's, again, the free application for federal student aid. I have the school code on the next slide. I'll share that with you. Again, that's based off what you qualify for. Tuition reimbursement, I always stress that. Look into it. Your employer may have tuition reimbursement. There are certain things you're going to want to figure out. How much does it cover? When does it cover? Meaning, does it start on a calendar year or some sort of an alternative fiscal year? What are the amounts that it covers up to? How does it cover? Does it cover just in general, or do you have to get an A or a B or a C to cover a certain amount? So that is another way that you could possibly reduce the cost and maximize your employee benefits, right? That's something that's there for you. You should see if you can take advantage of it. Obviously, we can explore veteran benefits and things like that, and then cash paying as well. So we do have students that are able to pay upfront by term, or we can put you on a payment plan during the term to cover the cost and spread it out a little bit for you. So again, here's the cost. Several different options. You can do a combination. You can apply for financial aid and utilize tuition reimbursement and pay for a portion in cash. Whatever works best for you. There is some flexibility there. Again, check out the partners page just to see if maybe you qualify for a discount. All right, so admissions process. So if you think this is a program that would be worth it to you and work well for you, then go ahead and fill out the application. There is no application fee. It is free to apply to our program. So you'd go to this website and you'd complete the online application. You're going to want to order your official transcripts. The university will only do evaluations on official transcripts. So we want to make sure we get your official transcripts in as quickly as possible so we can get those evaluated for you. If you want to take advantage of that credit for prior learning I mentioned a few times, then you would want to gather those additional exams, certificates, trainings, things that you've completed so that you can submit those as a portfolio to be reviewed. I mentioned applying for financial aid. You would go to the FAFSA website. When you go to apply, it's going to be an option on there to list the schools that you would want your aid report to go to. You'll then put in a school code. Excelsior's school code is 014251. That's then going to send your aid report to our institution so that we can see what you've qualified for. And then lastly, the application. Some additional steps to take. We would want you to let us know of your interest. That way our admissions team can engage with you. So you can do that by simply emailing this email address here, which is partneradmissions@excelsior.edu. Again, just brief, hey, I'm interested in the pre-licensure Bachelor of Science in Nursing program. I just attended the information session. Here's my questions, or here's a little bit about me, something along those lines. If you would like a phone call from one of our admissions advisors, you can go ahead and include your phone number and a good time for them to reach you, and they'll do their best to reach out at that time to get in touch with you. We do require that our applicants complete the TEAS exam. So here's the information on where you can register, and you do need to complete the TEAS. We are looking for a composite score of a 58.7. And we're looking for a minimal in the science section of a 75. Those results would need to be within a year. So you would need to complete that exam within a year or have completed it within a year. And then lastly, all applicants would need to be able to pass a background check and a drug screening. And we use Castle Branch to do that. So you would log into Castle Branch and you would need to purchase the package code XC21. That is a background check and a drug screening. So those are the additional requirements. So TEAS exam, as well as Castle Branch. And then lastly, something else we're really excited about, we are going to be hosting an open house just a couple of weeks from now. So April 1st, it is a drop-in format, so anytime you can swing in between 10 to 7 on April 1st, we would love to see you in person. We're going to be covering a lot of this information again. I believe we're going to have some snacks and some refreshments. We're going to be giving tours. You can sit down with an admissions advisor, have a more detailed one-on-one conversation, and we'll have an opportunity for students to apply in person on that day as well. So again, if you're in the St. Pete's area and want to come see the site, April 1st, 10 a.m. to 7 p.m., we will be there. Myself, I'll be flying in so you can meet me, and I would love to meet all of you. That is it. I mentioned this would be short. We have a few minutes left for questions. You can use the Q&A feature or chat. I see that some folks have already been using chat, and it looks like some of us have been applying a little bit. Nathan has been in there. So if there, so the LPN question, we do have some other programs. So this is possibly an option for you, or there are some other programs that could be an option. So I see Nathan did chime in there. This is for Florida residents, correct? You do need to live in Florida at the time of your application to be able to do this program. We see your contact information. If you could email that email box with your contact number, that'd be great. I believe we do review straighter line, so I would definitely submit those transcripts if you have straighter line transcripts.
If I could just chime in for a moment on a transfer credit. So we do accept Straighter Line and other non-regionally accredited schools for some of our of the requirements, but not most of them. So the majority of the course requirements need to come from a regionally accredited school. So if you're looking for a place to take other courses, I would just make sure they're regionally accredited.
Appreciate that, Nathan. I see that Dr. Owens chimed in,
Yeah,
clarified it.
I wanted to jump in for a second, Chris. So I see a few more questions that are coming out. So we do have an RN to BSN program. So once you finish the associates program, if you're already in that program, um, you can go into our RN to BSN program. And that is for open to residents of any state that we're accepting students in for our website. Um, this is a pre-licensure hybrid BSN program. So it's for students who may have some healthcare experience. They may not have any healthcare experience, maybe changing careers, just, you know, um, whereas our associates program is designed for students who are already licensed in some capacity, such as LPNs, paramedics, or certain military corpsmen. So this BSN program is just for Florida because it's on location in St. Pete. So students will be required to come to the St. Pete site for labs. We will have labs in evenings. I saw a question there if we will be having labs in the evenings. And yes, we do have the option to have labs in evenings. And we have several clinical partners in the St. Pete area that we are partnered with. Um, so we will be working primarily out of that area. That's where our labs are located. That's where our simulation will be happening. And that's where a majority of our clinical experiences will be occurring. And Jasmine, I see you're asking about a clinical site in St. Pete for ADN. Not yet.
Know we are at time. I appreciate everyone that joined us today. I have no problem hanging for a few additional minutes if anyone has additional questions. That is it for the presentation portion, though. So if you've um, you have the information that you were looking for, again, thank you for taking the time and checking us out today. Feel free to email any additional questions to that email that was provided earlier, this partner admissions at excelsior.edu inbox. We can answer questions there as well. So again, thank you, everyone. And if you have any other additional questions, email them to us. And that is it for today. So we really appreciate everyone's time and attention. Yeah, for the FDNY, you would need to be in Florida. So this particular hybrid program would not work for you all. However, we do have the associates in nursing that we can definitely provide information and follow up as well. And I know there was a decent number of you all that registered for this. So we always could set something up specifically to touch base with all of you. All right. Well, I believe that is all we have. So I appreciate everybody's time. This presentation will be recorded and sent to all of you. So you'll get a copy of this in an email follow-up here shortly. And again, if you have any other questions or if you are interested, please let us know at the partner admissions at excelsior.edu inbox. And we look forward to hearing from you all. Thank you again.
Thank you.